This is Torian Gibbs, and this is my presentation for Nursing 4400 on the isolated. This is my vulnerable population. Spent a lot of time with them this semester. This can be anyone from a farmer to a soldier, anyone living in rural communities, and it applies to everyone right now because of the COVID-19 pandemic, because we're encouraged to isolate ourselves. So let's get started. Right now in the media, things are being tossed around pretty loosely as far as the risks. Everyone is encouraged to self-isolate. So there you can see at the bottom, I was reading a study from this year showing that from 2019 to 2020, just in the span of 1 year, anxiety has increased threefold and depressive disorders 4 times more likely than last year. And this is all due to the media. So in movies and TV, isolated people can be portrayed kind of comically as like hillbillies living out in the middle of nowhere, but these are inaccuracies and people should be treated with more dignity and respect. So yeah, it's applicable to everyone right now. So with family support for the cultural environment, this is kind of funny because there's a lack thereof. We have a ton of people living in, it's almost 20% in the United States living in rural areas. They have small communities, there's minimal support. And this is difficult because humans tend to thrive in collaborative communities. So although there's not a lot of family support, it's just by the nature of the beast. I found a cool group like Alone Together. It's a cool hashtag that's available in every state. There's support groups everywhere where people can connect and educate themselves and be together alone, essentially. It's kind of a cool program. So the lack of support definitely increases the risk of poor health outcomes. And like I included there at the bottom, there's a 50% higher chance of unintentional deaths, and that's because of the fact that you're alone and you have poor access to healthcare. So the role of peers, is it supportive or destructive? People that live in rural communities have the lowest recorded leisure times. So lowest reports of recreational time, and this leads to loneliness with isolation. So there's a ton of studies that show the stress and anxiety of being isolated and alone. It increases health risks that are comparable to being obese, having heart disease, smoking, and funny enough, these people have the highest rates of cigarette smoking, obesity, and hypertension. So the role of peers is very important because people need human interaction and they're just not getting enough. So can it be cyclical in nature? The answer was like yes, 1,000-fold. Interesting journal that I read was on the persistence of poverty. So there's lots of studies that show that if you're poor this year, the likelihood of being poor the following years is like almost guaranteed. And people that don't have educations, well, if you're parents and you do have an education, your kid has 2/3 more chance of going to college. So yeah, it's a vicious cycle being in poverty and being in rural communities. So education and labor skills were the strongest forces to lift households out of poverty. So there are ways to improve, although it is cyclical in nature. So how does the legal and political system help? Well, there is a Federal Office of Rural Health Policy, and they pass their powers to each states individually, and it's pretty interesting to read. In Utah, we do have a rural health department, and they have tons of supportive services for everyone. One that's really cool is the Behavioral Health Force Reinvestment Initiative. That's brand new. It's bringing in healthcare workers to rural areas. So You have incentives to move out and serve these communities where there's low population numbers, and their main focus is on optimizing rural health. So I thought it was really cool that they're working on telehealth big time right now, because it's a great way to be able to talk to a healthcare provider even though you can't travel. Uh, and they maintain emergency services. They ensure basic health care for rural citizens. It's our political system is pretty good in the United States, especially in Utah. So, what are some of the potential barriers? Culturally and religious beliefs play a role because of the stigmas and taboos that we have, or that people are uneducated. And I thought it was funny with polls. Everyone thinks that they're all conservatives, clinging to God and guns, and they're all uneducated. And there are stereotypes that are partially true because the education is lower in isolated people, and they tend to use more antiquated like health remedies, like old wives' tales. Putting honey on something will magically cure it, or using tomato sauce for something. So it has to do with education. It's the biggest potential barrier. And on the international scope, this is really interesting. We're talking about where isolated people are shunned. I was reading an interesting article by Dr. Cecilia Toccoli. She was talking about how there's a stigma with rural migration, how people think that there's a transfer of poverty, that rural poverty-stricken people are bringing that poverty into the urban areas. And so there needs to be a support for urban growth from rural areas, and to reject the notion that they bring the poverty with them. So migrants need better rights, and this is a huge problem around the world, especially in developing nations. Socioeconomic status is the biggest problem. So they have higher rates of poverty in rural communities, and this has a negative outcome because more people have less health insurance. It showed that 9% of isolated or rural people don't graduate from high school, and the same percentage, 9%, don't have health care. So not only do they have less money for basic needs, I mean, they don't have money for health care, and they don't have easy access to it. Race and ethnicity. Rural communities are predominantly Caucasian in Utah, but there were some interesting statistics. Right now, there are polls taken with people that are isolated, and blacks are reporting that they're using controlled substances at a higher abuse rate. Hispanics had a 5% higher risk for anxiety disorders, and the biggest problem was age. It wasn't race. People that are older than 65 with chronic conditions have poor outcomes, and they have poor access to care because they're so isolated. So religion was really interesting also. I was looking at the LDS populations and how they help, but a cool study I found on Medline indicated that mental health and well-being is improved with people that are participating in some kind of religion. It didn't matter what, but just the fact that they're part of a group and they're trying to better themselves, they had better overall health. So religion does play a role, and it's good to participate, especially when you're isolated. Gender, males had higher rates of suicidal ideation in isolated or rural communities, and females had poorer outcomes, and that was due to the fact that they lived longer. So it was people over the age of 65. There's a lot of widows that could be with their husband on a farm, for example. I have an aunt and uncle in this situation where my uncle passed away, and so she's alone, and that's a dangerous situation. Even though they prefer that lifestyle, they're just at risk because of loneliness and all the increased risks of health and drug abuse and suicide and depression and all that kind of stuff. So geographic, this is kind of like everything to do with my topic. They have people that are isolated geographically have poor access to healthcare. The mean time of travel to a hospital or to a clinic was 29 minutes, half an hour. And that was just the mean time. There were areas where it was like well over 2 hours to get help. So in these areas, there's lack of coordination between health services, and it's significant. I mean, 15% of our population lives in rural areas, and they have poorer access to healthcare that they need. So here, this was a really cool map that just showed all the little blips of where in our state we have hospitals, healthcare clinics. These are specifically for rural communities. So even though you think nobody's living where all those dots are, out in the middle of nowhere, it's not just Red Rock. We do have healthcare services for isolated people out there. Implicit bias is unconscious. We're unaware that we have biases, and I think as nurses, when people come into the hospital, for example, sometimes we judge the way they look. If it's like a farmer or a military service guy, you feel like they might be uneducated, or you just have biases, and you treat people differently because of that. So explicit biases are what we actually verbalize, and we can work on both of these things initially by understanding people that are isolated and knowing that they have special needs and they need a lot of moral support when they do reach out. So there are ways to overcome these biases, but it is a problem because they are viewed with a lot of taboo. So in the international scope, poverty was just such a huge key issue because it's a worldwide problem, and of all the social determinants of health, education is right up there at the top with economic stability. And so they have lower education rates and higher poverty rates, higher unemployment. So these groups around the world need a lot of help. And it was interesting because isolated people can live that lifestyle in the US with better outcomes, just simply because we have better health care. But there are health disparities around the globe, and especially right now, like we've been talking about, isolation are all of us. We have to self-isolate, so it's good to stay in contact, and even if it's just Zoom meetings or FaceTime calls with family, just try not to be alone too much because the stress will cause problems. All right, hope you enjoy my presentation. Thanks.